Thank you for joining us this morning in this very, very important forum, Embracing Life, looking at an issue that is top of mind for all of us with today's physically active and those people who want to regain their physical activity. We are honored to have you and some very distinguished speakers this morning who you will hear from and who will present some information that will be of great interest to you. We'll talk about osteoarthritis, what it is, the projected increase in incidence, the economic burden, and new exciting research that points to non-surgical approaches to treatment and management of this disease and this condition. We all know people who suffer from osteoarthritis. It's not our parents, it's not our grandparents, it's you and it's me. It's people like us who have been physically active our whole lives and now have change in lifestyle, can't do what we want to do, and don't want to turn to a surgical option because it's not always the first choice and it's not always relevant. What options are there for us? What choices do we have as people who suffer from osteoarthritis? And that's the information that we'll bring to you today. Recognizing this landscape, OSER and organizations represented today are committed to continued research, new therapies, and educating people on lifestyle modifications that can prevent or delay surgery for osteoarthritis knee pain sufferers. We're delighted to have medical experts from the Steadman Philippon Research Institute, from the American Medical Society of Sports Medicine, and we appreciate the support of Genzyme in this morning's program. First, I'm going to share with you a few facts that we'll hear repeatedly today about osteoarthritis. The incidence of OA is on the rise, and experts predict that by 2020, it will affect more than 40 million Americans and become the fourth leading cause of disability in our country. 46 million Americans have arthritis, and more than half of them, 27 million, have OA. Nearly 1 in 10 Americans aged 65 and older have symptomatic OA, and the number of seniors in the country is expected to double in the next 25 years. We know by practice that that age of 65 much lower in many of the patients that we see, that the physicians see with osteoarthritis of the knee. These numbers mean that the demand for medical care to treat OA will increase accordingly and will challenge healthcare providers of musculoskeletal care and increase the demand for surgery and the delay for surgery. Physician visits, impact on job performance, and dollars spent on osteoarthritis are compelling. In 2004, OA resulted in over 11 million physician visits, 662,000 hospitalizations, and more than 632,000 total joint replacements in the United States, with accompanying costs of $22.6 billion. The Arthritis Foundation, the CDC, has declared osteoarthritis an epidemic in our healthcare today, with the economic burdens and with the care associated. The average direct cost of osteoarthritis is projected to be $26,000 per year in out-of-pocket expenses, with a total annual disease cost estimate at $5,700 per person in those affected with OA. Today, we will hear about options, non-surgical conservative management to knee osteoarthritis from our distinguished speakers. I will give you a brief introduction of each speaker now, and during the program, I will just call them up to the podium so we won't break the program with individual intros and bios, so I'm going to share that with you now. Dr. Richard Steadman, founder of the internationally acclaimed Steadman Philippon Research Institute in Vail, one of the country's most preeminent sports medicine orthopedic surgeons. Dr. Stedman has treated athletes of all ages and all skill levels, and is one, if not the most respected orthopedic surgeon for the physically active and athletic population in our country and throughout the world. Joining him, Director of Research at the Institute, is Karen Briggs. Karen and Dr. Stedman have partnered for years in scientific research, and because of that partnership, has brought great information to you, to me, as well as to the scientific community. Karen has held positions at the University of Colorado Health Science Center, the University of Colorado Medical School. Both Karen and Dr. Stedman presented the research that you will hear today at the recent 2010 Orthopedic Academy meeting held in New Orleans. We're also delighted to have Dr. Margot Patukian with us this morning. Margot represents the American Medical Society for Sports Medicine, where she served as president and is currently a board member of the foundation. Dr. Patukian serves on the American College of Sports Medicine Board of Trustees. She is currently Director of Athletic Medicine and head team physician at Princeton University, and will provide insight on the etiology of osteoarthritis and lifestyle modifications that are all important in changing the course of this disease. Dr. Joseph Ruan is the medical director at McConnell Spine, Sport, and Joint Center in Columbus, Ohio. He will discuss multimodal therapy, combination therapy, because we know the combination of treatments is really the answer in the conservative management of knee osteoarthritis. Dr. Ruan is the Assistant Clinical Professor of Medicine at The Ohio State University College of Medicine and Assistant Clinical Professor of Sports Medicine at Ohio University Osteopathic College of Medicine. He has recently been named the head team physician for the Columbus Blue Jackets of the National Hockey League. Dr. Dan Ramsey is an assistant professor of exercise and nutrition at the University of Buffalo, where he teaches courses in biomechanics of movement. Prior to that position, Dr. Ramsey was a research scientist in the Department of Physical Therapy in the graduate program in biomechanics and movement at the University of Delaware. Dr. Ramsey will share information with us this morning on the biomechanics of knee osteoarthritis, how what's happening in the knee changes our entire movement and how we move day to day. He will also address the economic burden of knee osteoarthritis and share with you some additional details of what we introduced this morning. And you will also hear from Steve Peterson. Steve is an everyday person like you and me, whose life was changed by his disabling knee osteoarthritis, affecting his work, affecting his quality of life, affecting his physically active lifestyle. And through conservative management, returned to all of those activities with vigor. You'll hear his compelling story from a person, an everyday person, and how what we're going to talk about today changed his life and brought him back to life. We'll regroup at the end of the presentations for some question and answer, so please hold your questions, and we will address that in a panel at the end of all of the presentations.